Cyclosporine. This is an important medication to know because you will be tested on it, and you may give it depending on what type of floor you work on. If you work in an ICU, or especially like a transplant floor or a hospital that does a lot of transplants, you're going to be giving this medication. The trade name of this medication is Sandimmune. So Cyclosporine or Sandimmune, you've probably already seen it. You've probably already seen it in some questions, and let's talk about it. So what it does is it prevents the rejection of transplantation. It's given for treatment of severe rheumatoid arthritis, and it can also be given for management of ulcerative colitis. Okay, so it kind of has a bit broad spectrum of action, but mostly what you're going to see it given for and what you're going to be tested over with it is the prevention of rejection in transplantation. So a patient comes out of a kidney transplant, they're going to be started on cyclosporine. And the way it kind of works, so what it does is it inhibits the normal immune response, basically and primarily by decreasing the activity of T cells and their response. T cells are a type of lymphocyte or white blood cell, which play a role in cell-mediated immunity. So really what it does, it just decreases the effect of these T cells and their response, thereby decreasing the immune response. Therapeutic class is immunosuppressant and antirheumatic. Pharmacologic class is cyclic polypeptide. All right, there's a couple things to really keep in mind here. First of all, we talked previously about corticosteroids and things like that, but what can happen if you give this with a corticosteroid is that it increases immune suppression. So in patients who have autoimmune disorders, you really need to be very careful in these patients, especially if they're already receiving corticosteroids, and then you throw this on top of it, they're going to have a very decreased immune response. It can cause seizures, tremors, hypertension, hepatotoxicity, diarrhea, nausea, vomiting, and gingival hyperplasia. Okay, so a lot of things to really keep in mind here. Big ones again, seizures and tremors, hypertension. Avoid with grapefruit juice while taking these medications. So one thing that you really want to keep in mind, a lot of patients, once they become ill, once they start taking multiple medications, we talk about this all the time, they really kind of need to stop drinking grapefruit juice, okay? We're going to be assessing our patient for any sort of signs of organ rejection and just really keeping an eye on that. Of course, that's why we're giving this medication, so we want to be very careful. One thing you need to educate your patient prior to going in for transplantation is you need to really educate them that this is going to require lifelong therapy for transplant patients. Okay, it's not something that they have their transplant, they come home, they take the medication for a couple weeks, and then they're done. They're going to be taking this for the rest of their life. Again, remember, it can cause hypertension, so you want to educate your patient on how to take their blood pressure. Again, I just want to stress the importance of monitoring immune function and just really letting your patient know that they need to report any signs of infection and that they're going to have to be treated very specially because of the fact that they are taking the Sandimmune and then possibly also taking other corticosteroids. All right, so that is Cyclosporine. This has been another episode of the MedMaster Podcast by NRSNG. To keep the learning going, head over to medmastercourse.com and use the coupon code PODCAST. MedMaster Course is the ultimate guide to nursing pharmacology with over 30 hours of video and audio lecture material. Never guess a med again, crush the NCLEX, and have confidence in your nursing pharmacology skills. Head over to medmastercourse.com, use the coupon code PODCAST. We'll see you on the inside.